Hello, everyone. My name is Dr. Amal Mumtaz. I'm a PGY2 at University of Louisville, Department of Psychiatry, and today we'll be talking about virtual reality in psychiatry, a paradigm shift in treatment. So I'm pleased to present this topic today. I can say it has deeply captured my interest. So the selected article for a discussion is the use of virtual reality technology in the treatment of anxiety and other psychiatric disorders. So this is a comprehensive review. It provides an understanding of the state-of-the-art applications of virtual reality in psychiatry. Um, Throughout our session, we will explore both the advantages and disadvantages, which were highlighted in this article. And towards the end, I will conclude with my own insights and pose some critical questions that I believe require thorough consideration. So, what is virtual reality? This is a definition of virtual reality. It strives to replicate reality. It kind of seamlessly blends immersion and interactivity. And users fully experience VR when the virtual world convincingly mirrors real life encounters. So, achieving this sense of presence involves advanced technologies like head mounted displays, gesture censoring gloves, and synthesized sounds. And it stimulates multiple senses for active exploration. So, the most important question of all, what is the role of virtual reality for psychiatry? So, ultimately, I believe it is a potent tool for our psychiatric community. So, what are its advantages and disadvantages? Um, it offers a unique advantage. So, we have the ability to replicate, test, and refine user experiences in a secure environment. And at the same time, we cannot sacrifice real world relevance. So we are control over sensory cues, especially our auditory, tactile, and olfactory systems. It kind of heightens the realism and memory of the virtual environment. So over here, I would basically like to discuss the evolution of virtual reality. It actually goes as far back as the 1950s to 1960s. So in 1957, Morton Hellig invented the sensorama. He kind of engaged the senses with smell generators and vibrating chairs for a multi-sensory experience. And in 1961, Philco Corporation introduced HeadSight, which was the first head-mounted display. And it had motion tracking and dual monitors for military training. So in 1965, Ivan Sutherland developed the ultimate display, featuring the first computer-generated interface for real-time interaction with VR. In 1989, Jaron Lanier coined the term virtual reality, and he was also the first one to formalize the concept and mark the beginning of VR's significant presence in research and psychiatric treatment. In the 1990s and 2000s, psychologists finally embraced VR. They started by using VR in prolonged exposure therapy. The first formal study on VR-based exposure therapy focused on treating acrophobia, and it yielded positive results. So this success led to further studies exploring VR-based therapy for anxiety disorders and various psychiatric conditions. This picture kind of shows an iterative evolution of virtual reality, kind of starting from 1938. It also shows how VR market is growing. For instance, it is expected to reach 34 billion US dollars by this year. Okay, so I would like to start by virtual reality exposure therapy because it has been most extensively researched. Extensive research supports exposure-based therapy for anxiety disorders, and it kind of reveals substantial treatment effects. So VR-based techniques are particularly well suited for exposure therapy because they leverage the sense of presence to immerse patients in tailored environments, activating and kind of modifying the fear structures. Um, and the modern exposure therapy aims to modify fear memories by introducing incompatible information and facilitating emotional processing. So the bulk of VR treatment research focuses on anxiety disorders, and it demonstrates significant decline in anxiety symptoms. VR exposure therapy has been proven comparable to traditional exposure interventions, yielding powerful real-life impacts and kind of maintaining stability over time. The meta-analytic results suggest a small effect size actually favoring VRE over in vivo conditions, emphasizing its effectiveness. So here we have a slide which shows the advantages of virtual reality exposure therapy. So the first one is overcoming imagination barriers. So VR potentially eliminates barriers in traditional exposure therapy by aiding patients who struggle with effective imagination or visualization. It is cost effective and practical, actually, because traditional in vivo exposures can be costly or impractical, while VR offers an inexpensive alternative. It kind of makes it feasible for constructing exposures that might be difficult to implement in real life scenarios. I do know that Dr. Wright once procured a wasp's nest by himself for rapid exposure therapy for a patient. I can imagine it might have been difficult. Um, the third is manipulating resources, manipulating exposures. So VRE basically allows us to manipulate exposures which are not possible in real life or in vivo. It kind of offers features like repeating scenarios multiple times and complete control over dose and exposure environment specifics to kind of match the patient's specific feared stimuli. Confidentiality and control. So VR ensures confidentiality during exposures, and it also gives providers precise control over the exposure environment. It kind of optimizes individualized pacing through exposures. Next point is patient satisfaction. Findings suggest higher patient satisfaction with VR-based therapy. And there's some studies which indicate higher acceptance compared to traditional approaches. A very important point is acceptability and willingness. So studies indicate there are lower refusal rates for VR exposure compared to in vivo exposures, and patients express willingness to use VR approaches. So this potentially addresses the barriers to treatment, especially for specific populations like post 9/11 soldiers. So the treatment course for VRE. First, the introduction and education. So initial sessions focus on disorder education, psychosocial history, and avoidance overview, and then introducing coping strategies like breathing exercises and cognitive restructuring. There are graded exposure sessions. Subsequent sessions involve individualized VR exposures following a graded hierarchy. Progression is collaborative. It is repeated until significant anxiety reduction occurs. Next is tailored content. So pre-selected VR content matches specific disorders and the patient fears. And thorough assessment guides content selection for personalized exposure. And next is therapist engagement. Therapists skillfully engage patients in fear activation within VR, and they address safety behaviors, encourage emotional engagement, and discuss response prevention. So moving on to the article, the authors conducted a systematic literature review using the search keywords virtual reality, psychiatry, anxiety, and specific disorder. They used PsycInfo, Medline, Embase, and Google Scholar for it. The inclusion criteria was set to psychiatric patients receiving interventions based on VR. The exclusion criteria was set to studies lacking outcome measurement. They did not use trial criteria due to the novelty of the topic. This video is an example of what to expect from exposure. Let's watch this together. And this example was taken from an open source project. I'm going to play the video now. All right, let's start with virtual reality for specific phobia. So we all know what specific phobia is. It involves marked fear and anxiety related to specific objects or situations. So most of the studies were kind of focused on fear of flying. It was extensively researched in VR interventions. And the results for fear of flying were that within group studies, it showed a 25% reduction in flight-related anxiety and a 26% increased likelihood to fly post-treatment. So the randomized controlled trials demonstrated symptom reduction and behavioral change equivalent to CBT with maintained gains at 1 and 3 years post-treatment. So there were enhancements for fear flying utilized in VRE, such as physiological feedback and motion simulation together. So there's evidence for effectiveness for other specific phobias, for example, acrophobia, arachnophobia, and fear of driving. So the overall summary is that there are numerous studies which show VR-based CBT efficacy for specific phobias. RCTs with large samples demonstrate significant treatment effects and behavioral change. So treatment gains persist for years post-completion. So this offers a promising alternative for challenging in vivo scenarios. So virtual reality for social anxiety disorder. So we know what social anxiety disorder is. It involves anxiety in social interactions where a judgment or evaluation by others is anticipated. For example, conversations, public speaking. So VR-based interventions for social anxiety disorder utilize computer-generated social environments such as classrooms, auditoriums with virtual audiences. So the findings were that two randomized controlled trials found VR-based CBT as effective as traditional CBT and superior to control conditions. So VR-based CBT for fear of public speaking showed similar effects to traditional CBT, and it actually surpassed control conditions. Effects were maintained at 1 year post-treatment. So there is some preliminary data for school-based anxiety. There's some initial data that suggests efficacy for VR in treating anxiety, school-based anxiety, including test anxiety. There were some encouraging results. While there were fewer studies compared to specific phobias, there was some encouraging data which supported its effectiveness in social anxiety disorder. The main point was that it is cost-effective and time-saving. So VR is particularly beneficial for social anxiety disorder because it addresses the challenges in finding multiple confederates for social interactions, offering potential cost savings. So the conclusion is virtual reality serves as a valuable adjunct to CBT for social anxiety disorder, offering promising results and practical advantages. Now we can move on to VR for post-traumatic stress disorder. PTSD is defined as specific symptoms after history of exposure to trauma. So what is the role of VRE for PTSD? So the studies kind of showed medium to large treatment effect size. It outperforms waitlist controls comparable to standard exposure treatment. The key findings, VR groups showed significant decline in PTSD scores, sustained at 6-month follow-up, and it showed comparable effectiveness to present-center therapy. So the support for virtual reality exposure therapy is that it is effective for combat-related PTSD. So VRE and prolonged exposure show similar improvements post-treatment, and prolonged exposure demonstrated greater recovery at 3 and 6 months. So here are some research considerations for us. Most of the studies had small sample sizes, and future research, it could and should include larger trials and standard care comparisons. Next, we move on to virtual reality for panic disorder agoraphobia. It is defined as a sudden rush of anxiety with physiological and cognitive symptoms, leading to fear and avoidance of specific places or situations. So, what is the role of virtual reality for agoraphobia? It presents situations which elicit panic attacks, for example, tunnels, parking lots in virtual reality. So there is support for VRE. There are multiple baseline designs which provide initial support for virtual reality in treating agoraphobia. So the RCT findings, there were positive effects for VR-based CBT for agoraphobia. They were varied results compared to traditional CBT, but most studies showed equivalent effectiveness. Moving on to treatment response and duration, VR-based CBT, it may result in better treatment response and fewer required sessions, particularly early in treatment. Equivalent longer-term treatment effects were observed up to 12 months post-treatment. The advantages of VRE for agoraphobia. Rigorous studies support efficacy. Advantages include improved treatment response and decreased time required for treatment. Virtual reality for generalized anxiety disorder. We all know what generalized anxiety disorder is: persistent, excessive, and intrusive worrying, leading to difficulties in daily functioning. There was a study by Gurini and colleagues, which was a small scale randomized control trial using virtual reality with biofeedback for relaxation exercises during treatment. So there is preliminary support for the feasibility of using virtual reality for generalized anxiety disorder. So, but there are challenges in generalized anxiety treatment because there's difficulty in creating standardized VR scenarios which actually capture the individualized worries of GAD patients. The potential focus areas for VR-based treatment: we need to address the common worries, the health anxiety, concerns for loved ones, etc. And this can serve as a visual guide for practicing relaxation, mindfulness, and breathing exercises. Moving on to virtual reality for obsessive compulsive disorder. Obsessive compulsive disorder is marked by intrusive thoughts, images, or impulses causing anxiety and leading to repetitive behaviors. So the current research status is that there are no randomized controlled trials which assess virtual reality efficacy in OCD treatment. Studies show that virtual reality's ability to elicit anxiety in OCD patients by exposing them to feared stimuli might show some promising result. And then there is the aspect of immersion and anxiety. There was a positive association between anxiety levels in immersion in VR scenarios, which could be employed. The challenges in VR treatment for OCD are that there are different, our patients have different obsessions and compulsions. There's difficulty in developing VR programs for the diverse population of our patients and their diverse needs. The advantages of virtual reality in OCD treatment: it may be advantageous for obsessions which are not suitable for traditional exposure therapy, for example, exposure to public restrooms. There's promising data for VR-based CBT, but it does need further research. So here is a picture. Moving on to virtual reality for schizophrenia. So schizophrenia, a severe mental illness with psychotic symptoms, disruptions to emotional behavioral functioning, and cognitive processing difficulties. So there's actually very limited research in schizophrenia. So the bulk, the preponderance of virtual reality research focused on anxiety disorders and not so much on psychotic disorders. There's limited data, but initial investigations show promise in treating schizophrenia. So what is the use of virtual reality in schizophrenia treatment? So virtual reality scenarios include social situations for coping with social distress and practicing skills which our patients sometimes very direly need. So the randomized controlled trial combining virtual reality-based social interactions with exposure and cognitive therapy led to decreased persecutory delusions and distress during real life or in vivo social interactions. We know how distressing they are for our psychotic patients. So it is an adjunct to social skill training. There are two uncontrolled pilot investigations which support efficacy of VR in improving social skills and interactivity. So there was a randomized controlled trial with 91 schizophrenic individuals, which found social skill training with VR components increased interest, skill generalization, conversational ability and assertiveness of patients with schizophrenia. So there are promising results, preliminary but promising results. They kind of address the barriers to providing exposure to social interactions in our patients with schizophrenia. So there's definitely room for more research, more room for growth. So here are some other results for acute and chronic pain. Virtual reality does prove to be effective in pain management. So how does it do that? It provides cognitive distraction during medical procedures, and facilitates the learning and practice of pain management techniques. So these are promising avenues for both short-term acute pain and chronic pain interventions. Moving on to addiction. So, virtual reality cue exposure therapy demonstrated effectiveness in eliciting the craving and physiological arousal related to substance cues across different addiction populations. So, it did prove to be a promising tool for kind of integrated therapeutic approaches in drug and alcohol addiction treatment. Moving on to eating pathology. So virtual reality approaches have shown promise in addressing body image disturbances and concerns related to eating, shape, and weight. So there is some preliminary support in comparison to traditional CBT approaches. Moving on to autism. So the preliminary research shows that virtual reality does show promise in improving social communication and interaction skills in individuals with autism spectrum disorder. So it does demonstrate feasibility and effectiveness in our psychiatric treatment of these individuals. So here were some recommendations from the author. The first one is sequential integration. So the author recommended to incorporate virtual reality into treatment sequences where real life or in vivo exposure would typically occur, providing specific protocols for various disorders such as fear of flying. The second point is essential equipment. So the author recommended to ensure proper equipment. We all know the challenges we face with equipment, technological equipment. We are not, I mean, I'm not tech savvy. I don't know about the rest, but I've run into many problems with computers and figuring out the different gadgets. So the author definitely recommended to use proper equipment, including a computer with dual monitors, head-mounted display and platform. So this would basically facilitate effective VR exposure therapy. Another thing is specialized training. So the author recommended comprehensive VR-specific training for therapists, both online and on-site courses, with emphasis on proficiency in technology, troubleshooting, and rational communication. The author also recommended to prioritize sufficient training in exposure therapy, especially for providers, before integrating virtual reality. And there has to be ongoing supervision and support to maintain the proficiency. Effective communication, equip providers with strong communication skills to convey the rationale for VR therapy. This will ensure patients understand its purpose and it will foster a positive therapeutic relationship. Quality assurance. So the author recommended to basically emphasize the importance of maintaining high standards in exposure therapy, even with VR. So this basically highlights the need for continuous training, supervision, and support to ensure quality patient care. This picture illustrates a technology aspect of what to expect from the future, although I'm not predicting the future. Maybe it will look completely different, but this is what we have right now. So here I would also like to speak about the most recent reviews. So I'd like to give an overview of meta reviews. There were 2 recent meta reviews published. There were total of 28 and 25 systematic reviews and meta-analysis, 28 systematic reviews and 25 meta-analysis. These reviews basically highlighted the utility of VR in supporting psychiatric disorders. They outline various mechanisms. So the study aims to broadly characterize the existing literature on VR applications through a systematic review of reviews. So conclusion, virtual reality has evolved into a valuable tool for various mental health disorders, and we need to keep up with the evolution. So it's particularly useful in exposure therapy for anxiety, cue exposure therapy for substance use disorders, and distraction for acute pain during medical procedures. So there are meta-analyses which supports its efficacy, and they show that there are lasting real-world benefits. So we do have promising results, but there are challenges, like most of the studies are conducted using small sample sizes, and methodological issues still persist. So VR is becoming more accessible, and I highly there's no doubt that it will continue to become more accessible. Proper training for therapists is crucial for its effective integration into mental health treatments. So, what are my insights? So, there is an increase in the popularity of new technologies. It is inevitable. Um, there is, I mean, they're widely popular now, and we need to keep up with what is going on in the technological world. So especially in the areas of health and education sciences. So from year to year, the need to confirm the efficacy and usefulness of VR in different areas, it grows at an extraordinary pace. So analysis of the dynamics of the increase in number of publications in VR in the PubMed database show that approximately half of all the articles, around 5,589 out of 10,914, have been published within the last 5 years alone, from 2015 to 2019. So the continuous advancement in virtual reality technology, if you combine it with increasing interest from major companies, it does open up new possibilities for its applications in mental health care. So the key lies in identifying areas where virtual reality can offer innovative solutions for both us care providers and the patients. So the emphasis on personalization is crucial. We need to tailor therapies to individual needs. It will not only enhance the effectiveness of treatments, but it also aligns with the evolving landscape of precision medicine. So, moreover, the potential of mixed reality, which combines the element of virtual and augmented reality, it opens new frontiers. So mixed reality could offer more immersive and interactive experiences. So it could revolutionize mental health therapies. Thank you very much for listening. I will be taking questions now. Yes, please, Dr. Lipman. Dr. Lipman?
There you go. Is that better? You did a good job. You really talked to us. I could understand everything you said. Darn
Thank
good.
you.
That's excellent. Very nice.
Thank you. Thank you very much. All with your help, Dr. Lipman. We highly appreciate your guidance and counseling. Yes, Dr. Bonomo.
Yeah, well, thank you, Amal. I wanted to let you know, I thought this was a very interesting topic, and it is actually a lot more relevant than we realized. I was wondering if in your time reviewing for the topic, if you had covered anything regarding like the treatment of phantom limb syndrome from using virtual reality.
I'm sorry, with syndrome?
Phantom limb syndrome?
Yes, that is actually very interesting. And I don't believe there have been any studies conducted on that, or if they have very small sample size, but that is a potential area for research. And again, there's lots of potential for research in this. So that could actually be very, very interesting.
Yeah, the reason I brought up is because I do know they, like you said, they had ran some very small studies in the past using it to try and treat like release hallucinations, tactile release hallucinations, and there really is so few treatments for phantom. This is one of the things I think that will end up being approved. It's just, it takes a long time to find a sample, but I haven't looked into the topic for a while, and I appreciate you sharing what you know about it.
Of course, of course.
Just
Thank
to
you.
hop on that, Nick, you may have seen this, but there is mirror therapy for phantom limb syndrome. It's only for unilateral amputations. So say usually with legs. So they set up a series of mirrors. And say a veteran's right leg was amputated from a car bomb or something, they'll put their left leg in this mirror contraption so they can look at their right leg. It looks like they have a right leg again, and they move it around, and that actually has had good results for phantom limb syndrome.
Well, thank you. That's actually really cool.
Yeah, look up I think it's called mirror therapy, phantom limb syndrome, and I know they're researching it a few years ago. I haven't seen anything recent about it, but it kind of goes along with the virtual reality setup.
Yeah, that sounds super super amazing. The review article basically was focusing on the psychiatric disorders and very very limited disorders which were limited to our mental health. But I mean, virtual reality, it can have very wide applications in the medical field as well. So definitely.
I just have a quick question regarding
Yeah.
the study in schizophrenia and virtual reality. And
Mhm.
I think a lot of these aspects, like social anxiety, OCD exposure therapy, I think all that can be very helpful, could be very helpful, but for virtual reality, obviously, we want to have real social exposure, right? Because you don't
Mhm.
want to just be, you don't want to live in, Player One or whatever that movie was, where everyone's living in virtual reality. My
Mhm.
concern with schizophrenia is, was there any research looking at delusions of reference or derealization symptoms with patients with schizophrenia? Because if you already have a disconnect from a disorder that disconnects you from reality, like
Mhm.
schizophrenia, I imagine that could be even worse in virtual reality. Was there any like significant side effects with that study or any note of that?
Yes, so that is a very good question. And I was just discussing it with my students earlier that our patients are already detached from reality and we're exposing them to virtual reality. So, which is why, again, the recommendations, the process needs to be very carefully monitored with proper training. So, unfortunately, the studies are very limited for schizophrenia. They were small randomized controlled trials, and they basically did not mention any such side effects. Actually, they did show that VR-based social interactions, they actually led to decreased persecutory delusions because of decreased distrust during real-life social interactions. I don't believe the delusions of reference were mentioned, but I highly suspect that with further research, more extensive with large sample sizes, more RCTs, it would very well come up, and it's a point to definitely consider.
Thank you, I appreciate that.
Thank you. Dr. Lipman? Does anybody have any other questions?
I think Will has a question, but I can't bring him in as a panelist.
It looks like Dr. Pawa put a question in the Q&A as well.
Yes, so Dr. Pava is asking about mixed reality, and that is a very, very good question. It is the latest technology available to us. I wish I can show it to you. It's better explained if you see it, but I'll try to put it into words, in my own words. So far we've had virtual reality. For example, if I'm sitting in this room right now in this chair, virtual reality will basically create the whole surroundings around me. Whereas in mixed reality, the place where I'm sitting, if it's a room, my surroundings remain real with basically virtual reality aspects dropping in. For example, if I'm in this room and I want to see a spider drop in from the ceiling, for example, I could just watch it while remaining in the current surroundings. I hope it makes sense, but I wish I put a video showing it. It's really fascinating. Yes, it's I mentioned it as my insight. It could have great applications in using for treatment of our mental health disorders.
It's the
Hey,
same
Amal.
thing. Sorry, I was gonna say it's the same thing, kind of like Pokemon Go, right? Where there's a game on your iPhone that superimposes an image on on the real world. So like
Yes,
there's Pokemon
yes.
in our real life, basically.
Yeah, kind of exactly like that. So far it's being used to kind of play games. I mean, people are using mixed reality. So this is where our questions comes in as psychiatrists. How can we utilize this aspect in our field? So it's kind of similar to that. Yes, basically. It's actually really cool.
Hey, I have a question. Thank you for your presentation. It's so interesting. Is anybody around Louisville or Kentucky already providing this service? And the follow-up question to that is, do you see insurance covering this service, or do you feel like it's just going to be the therapist or doctor procuring the device themselves and providing the service to patients? Thank you.
You're welcome. So very good question. As far as Louisville is concerned, I did ask Dr. Wright during one of our lectures if virtual reality has ever been employed at our University of Louisville clinic. And he said they had somewhat similar some headsets earlier on, but they went obsolete because of I believe because of cost issues. And he did say that they were very widely accepted and they were very efficient. And I do believe that as far as cost issues are concerned, the technology, it's kind of getting less expensive now. So as far as providers in Louisville are concerned, I don't believe I'm aware of anyone providing such services. And sorry, what was the other question?
I was wondering if insurance would cover it or create a code for this service, just out of curiosity.
I have no idea at all, actually. I don't know if it will cover it or not, but I mean, based on the research, the extensive research, it's growing. I'm pretty sure with the amount of research that is out there proving its efficacy and its patient acceptability, I'm hoping I'm hoping so. Does anyone else have any questions? Should I wrap up, Audrey?
Yeah,
If there are no more
yep.
questions.
All right, well, thank you very much for listening to me and all these interesting questions. And thank you very much again. Have a good day.